Hi everyone, this is our first episode of Alba Child Health and Nutrition. Welcome, Erica. Today we have an amazing guest, Dr. Erica Bonds. I'm really excited about this episode because, as many of you know, at Alba we interview scientists and researchers and we talk about child gut health and nutrition. But today we have a doctor, a pediatrician, who sees patients, kids, all the time with a lot of experience. So today we're going to take a different angle. We're going to see the doctor's perspective and your opinion and your experience on this. So Erica, you have an amazing experience. Tell us a bit about yourself.
Thank you, Nora, for inviting me. Very happy to be here. So as you said, I'm a pediatrician. So I work with as a doctor with children in my daily life and my clinical practice. And I've been working with children in the Nordic countries, but also a bit in Africa, and a lot with baby well centers. So we see the health part of the children growing, but also everything from outpatient clinics, ward rounds, A&E, emergency medicine, and I can say wherever I've been, even with the children's psychiatry, whatever kind of clinic I've been working with or at, you can say that gut health in some way is a topic, comes up on the table. So of course, the smaller the child, the more common, but I think it's a really interesting topic because it's just part of the growing up, part of being human, body and soul, and gut health is really, really important.
Yeah, exactly. And you also have a personal interest in gut health and nutrition, and you told me a bit about your personal story as well.
Yes, thank you. Because of course, we all got the gut. We've all got some kind of experience ourselves. But I'm also a mom. And when my children were young, actually up until the age of 3, all of them reacted in some way to rice. Not that bad. Not that they had eczemas or like couldn't focus, but from a normal day. They usually slept very well from the very start, but we realized sometimes they didn't, and then it took me quite a few weeks actually to understand that it was from rice. So that's just so strange, and I've talked to colleagues about this, and I've read in the literature, and it's almost not written about. It's like. It's nothing we would say from the healthcare system that maybe if the child is unhappy and getting a lot of gases, it might be due to the rice they've eaten. And so when they became a little bit older, they were able to eat like sushi rice, like thinner rices, but not porridge rice. So it was also a little bit of development there. And then when they became school age, that's not a problem anymore. But it's just very interesting because there are so many things out there that we don't know. And also sometimes we feel as parents that healthcare professional they don't understand us. But maybe we just haven't seen it all yet. So I think it's very interesting to go into newer and more in-depth studies. What's actually going on in our intestines. And also I was part of a study almost 20 years ago that we looked at, sometimes I look at my career and say, well, we do medicine as we've always done, and then Corona hits and we started doing things differently. But then looking back 20 years, yes, things evolve and we do things differently. For example, the Rota vaccine that we've nowadays given, when I started, we didn't have that one. So the wards were filled with children in gastroenteritis needed IV infusions to manage. And during that time, we started trying probiotics and could see that it actually helped with super severe gastroenteritis.
Yeah.
And that's just so interesting. So I think that was when it was super new, and then we can build on that knowledge And that's probably why we are here today.
Yes, that's so interesting. And that's something that I can relate because as you know, and I often talk about it, I had very severe eczema, and I was able to reverse my flare-ups basically with diet and understanding some food sensitivities. But as you say, this journey is so personal, and nutrition and gut health are things that seem to be so complex. We don't have straight answers in many situations. And what we do at Alba is that we try to uncover as much as possible. That's why we have a study, the PREVENT study, and we have 300 amazing families that have joined our study to try to uncover as much as possible. And that's why we interview scientists to try to bring what we know, because there are some things that we know, and especially around the importance of these topics. So today we're going to talk about gut health and gut microbiome and nutrition. And I would say let's start with the gut microbiome. So as you say, many things are changing nowadays. One of the things that is changing is that we're realizing that we have these microbes living inside of us, outside on us, and they're very important to be healthy. We cannot live without them. What happened, let's say, in the past century is that we discovered that some bacteria, some microbes cause disease. We came up with antibiotics, which was amazing and helped extend health span and lifespan of saved millions of lives, basically. Also, back then, you could die from an infection, you could die of childbirth. Today, it's much more rare. So antibiotics really revolutionized medicine. But now we also see that some of the microbes we have are good and we need them. And some of the things we do damage them in a way or affect them. So I would say my first question is, as a doctor, what do you know about the gut microbiome and what's accepted about the gut microbiome in general?
Ooh, only that.
Small question.
Yeah. But I think maybe we should go back and look at what is antibiotics.
Yeah.
Because maybe everyone doesn't know and understand that. Because we have bacteria, as we said, those are the nice, good bacteria that we talk about in gut health, which is promoting health. But then when we get an infection, so usually when we talk about a flu or anything that we get, my work as a doctor is to say, if we talk in general in children in today getting upper respiratory tract infections, is to say, is this infection caused by a virus or a bacteria? So that I think those are the first things that we need to understand. What do we mean with microbiomes? Because I mean, we have parasites, we have viruses, we have fungal infections, and we've got bacterial infections. So first of all, I'd want to say that antibiotics means against bacteria. Of course, also some fungal infections, and those are the things we have. But in general, we don't talk about the viruses. Nowadays, of course, we have a few antiviral treatments, but that's not the focus today. So antibiotics means killing those germs, literally bacteria that comes and gives us the ear infection or throat infection or pneumonia that comes from bacteria, or even sepsis, which means bacteria in the blood. So that is when we talk about saving lives. But giving those antibiotics means that we also kill or at least reduce the healthy bacteria we have in the abdomen. So I think that's something we need to start with, understanding that we want them, but we don't want them locally anywhere else, or in a wound or urinary tract infection, etc. We have different locations when we don't want them. So giving that, I would also want to highlight that in Sweden, especially looking back at my 20-year career, we've had a brilliant way of handling the antibiotics that we use. So we are very well aware of the resistance that is developing, and we only use the most narrow antibiotics that we need to. So that means that we are saving more of the gut health and gut bacteria that we have. So we don't immediately go into the broader ones, and even with children being ages 1 to 12, who's getting a non-complicated, a simple ear infection, for instance, we don't want to treat them with antibiotics because we have studies saying that the body can take care of this, and we do more harm than help. For instance, we rule out the own gut health. And of course, on a population level or a global level, we don't want the resistance to grow. So I think we need to understand that when a doctor says we don't need the antibiotics, it's because it's a virus and it won't help. So it's not that we don't want to help your child with this infection. It's just that it won't do any good. Yeah. Or it's the other thing that we know from studies that this will not reduce the time of the child in pain because the body can take care of, for instance, an ear infection. So I think that's like the main thing, that when we say no, it's for the patient, the child's own good, for instance, to save the gut health.
Exactly, and Sweden is one of the best countries actually doing this and trying to reduce the use of antibiotics to when it's necessary and when it's needed. Mm-hmm. We actually see that in our study as well, that antibiotics are used less than some rates that we have seen in other countries. So that's a good thing.
Yes.
And of course, also at Alba, we're not against antibiotics. They should be used when they're needed, when they're needed. But of course, then I do believe that in the future, the big question in medicine will be, how do we restore the gut microbiome whenever we take antibiotics or other things, because there's other things that affect the gut microbiome. How do we take care of our good bacteria? And in general, we know that the gut microbiome is important for our health. It's linked to the immune system, to the brain, to metabolism, for everybody. But it seems to be even more important in children because the first years of life, that's when we develop our immune system, metabolism, and brain. And there is this concept of the first 1,000 days of life. Can you tell us a bit about that?
Yes, so the first 3 years, that is when we are, so everything with the children is a development. And usually we have rules saying no milk, or no salt before the age of 1. And of course, I say the body doesn't understand the calendar, that this is 1 year first birthday and now we start giving everything. But everything is stepwise. So in general, we can say that the kidneys have been developed enough to tolerate the amounts of salt, and then it's fine to start eating normal food. So everything, of course, is a development, but with the first 1,000 days is the first 3 years. And that is what we have seen in studies, is that those bacteria that we have, the gut bacteria, usually goes along in life. And that's super interesting. So I would like to have more studies being made on detail, because it's a complex thing. It's everything. What are the routines and the flavors and what else is affected in the child's growing, but more and more studies talk about the exact gut bacteria with those first 3 years.
Exactly. And so the gut microbiome has been associated both to symptoms that many children have. So for example, colic or constipation, other kind of gut-related symptoms, but also to some chronic conditions later in life, especially immunological. So allergy, eczema, asthma, even obesity and weight.
Yes, and type 2 diabetes.
Type 2 diabetes, also type 1 diabetes, but there's a bit less studies, so we usually talk more about the other conditions, even to the brain. So there's many associations. What are, in your experience, the most common gut symptoms that you see in babies and children? and where you would like to see more studies also.
Yes, exactly. So I think we'll have to start and develop into different age groups because if it differs a lot, of course. But if we start with the first 6 months, of course we want to most of the children are breastfed, and that's something we want because we also know that we get immunoglobulins through the breast milk that also helps build up the child's immune system. So that is one part that is super important. But otherwise, we know that there are sometimes that we just simply can't breastfeed, and I just want to highlight that the formulas today are very, very good. So I think in general, before talking anything in detail about ages and amounts and recommendations, I would say first of all saying that a calm mother gives a calm child, and just the whole well-being situation. I think again it's body and mind. We are one person with body and soul, and we need to remember that, not putting in any more stress and saying that breastfed children are being this and this, but we're saying that if it's possible, we want to see that. But the formulas are super good nowadays. So I think that's the first thing. But when we talk about the guts, of course, we have breastfed children is usually in that matter the most natural, that we usually comes less problems. With breastfed children, we see a little bit more of weight gain later in life and a little bit more of problems with the guts, constipation earlier, and a little bit more of gases. And sometimes we don't know if it's only the technique of being or not breastfed by bottle instead. And of course, then we have the combination with having breast milk through a bottle. So I mean, we are super just flexible regarding that. But so I think the first 6 months we need to talk about the mother's food and what comes through the breast milk and what does the mother eat. So I think that's super important to have in the back of the mind, that already when you have the first weeks of life, the first months, the mother and the family can affect the gut health by considering the diet.
Exactly, because as you say, through breast milk, there's a lot of substances that are transferred basically to the baby. Part of them is bacteria, actually. The baby's gut is almost empty of bacteria when we're born sterile.
Yep.
We're born sterile, it seems. So the mother passes bacteria, but also some compounds that help the bacteria grow. And as well as you say, antibodies and other immune system kind of compounds, but also what the mother eats, those compounds go to the baby. And one of the areas of research is also regarding allergies, because one of the questions sometimes that we also hear from a lot of mothers, they say, oh, I'm breastfeeding my child, they have these symptoms, I stop eating dairy, and then they stopped having that symptom. What do we know about that? And also understanding that maybe we don't know everything.
Yes,
yet.
Exactly. We do not know everything. And I want to look back at your story. I think it's very interesting because that's something else I see at the clinic. The parents come and say, we want to test our child. And I always say that I don't treat numbers, I treat children. So I think the most important thing, the take-home message is you can't just look at a specific number saying that this is your health. You have to personalize the journey and see what works with in this case. And that's probably very important to say that we can test some things, but we have hundreds of different. We can check every single nutrient or actually food component. But what do we do with that? What does a little bit of raised numbers say? If we exclude this, will that make your child completely without symptoms? Probably not. And how much blood can we actually take, and what is relevant to do? So I think that is the main thing, that trial and error. That this mother, this food, and this child is probably to personalize the diet I think that's the main thing.
Yeah.
And also regarding the first months, I would say, as you said, the sterile environment, and then the family. We have studies showing that the whole family, and some also indicate that even if you have a dog, you have the same kind of gut bacteria in the whole family, just living close to each other. So the child is of course being exposed anyway to new gut bacteria. But if you breastfeed, or if you don't breastfeed, I want to highlight. Remember that you need to wash the equipment, that you need to heat the water because there might be bacteria in the stems. So you can't choose to take just from the tap hot water. These are usually basic knowledge, but I think it's good to highlight that everything in the environment affects us.
Yeah, definitely. And I think you touch upon a really important point, which is when we test, we have one data point, but medicine is complex because every person is so unique. So we need to take more data points and put them together into a picture and look at that whole picture. And that's what doctors do, right? It's not just doing some tests and giving an automated answer in a way. So a lot of people actually come to us and say, or that we talk to, they say, we tested our child for specific allergy and it was negative, but I see that if I don't give them this, they are better, or they have less of a symptom. How would you see that as a doctor? Does observation matter?
Super, super important question. And I think that's something we really need to focus on. And sometimes we also have to remember the bias that, like, what would this specific person, if we have these symptoms and we change this, we take it out, and then the child becomes better. Always remember to do the provocation again.
Yeah,
I think that's super important, that it might be, the gut developing, something else happening in the environment.
Yeah.
Was the child crying because of the teeth, or did it actually have another infection, like a virus, that gave the other symptoms? What else is happening around that we can't interpret or quite understand? So I think it's most important to look at the child. If this really makes my child better, of course that's something we should do, and not look at the numbers. But and also a little bit of different. I think that the answer is a little bit different if it's. It depends on the food. If it's something that, like, basic that you really need, or if it's something that it doesn't matter if I leave this little tiny thing out. So like also the need of the nutrient in what we're talking about. Like, but whatever it is, I think it's important to remember that you need to do the provocation and really check. Is this still the case? Because also we know, I mean, we also only came to the smallest, youngest children, but most of the allergies actually is outgrown. So we have different phases, and we can't say that this was the case. I heard of a child the other day that turned 18, and he hadn't been to any doctor since he was around age 6, and he completely left out milk his whole life. And I was like, well, what was the levels, and how bad is this really happening? And he's just they just never considered that it could be something temporary. So always do the provocation first every 6 months, and then if it's obvious that this is we've got all the risk factors and high levels, of course we don't have to do it again. We need to individualize the care that we give, but at least it absolutely does not make sense to do the whole puberty and become an adult without looking at what advice you got as a small child. So I would in general say with older children every second year. But again, that's just, something to consider.
And this is often called elimination diet. So eliminating some sort of food for a certain amount of time, as you say, cannot be 3 days while other things are also happening. It needs to be for some time, and then reintroducing it. And if you see that the symptom goes away and then it comes back when the food is reintroduced, that's an observation that could point towards this food is not good for you. Is that something that as a doctor you would recognize and you would call clinical observation, or how would you see that?
Yes, it depends a little bit on what kind of, if we talk eggs or milk or something like daily basic food, I would say that in a small child I would like to do a checkup every 6 months and depending on how severe the symptoms were. And of course, most of all, what I haven't mentioned either is, first of all, with every single patient I meet, the first thing is the growth chart.
Yes.
So the children, a healthy child is growing. So that's the first thing. And turn it around. If it's really, really bad, and the parents say that this is horrible, we always listen to the parents. They know their children, but still, if the child is growing perfectly, that's very we can relax a little bit more. That it's the most important thing with the child. So all of these things together, I would say that when the child is growing, if it's obvious that this is some kind of base food that you really need, I would like not to keep the elimination going, but always remember to double check because it might be that it's grown away. It might be a combination of things, or it might also be how much is too much, because you might get a reaction on, I don't know, drinking milk, but having it in the sauce is fine. Yeah. So it depends. We have to look at one individual separately.
Yeah. In what situations could an elimination diet help? With which symptoms could it help?
Good question. So I think it's all the classical allergy things, like we talked about, just actually having problems with the gut. So everything with pain, obstipation, gases, diarrhea. So everything with uncomfortable stomach, but also the rashes, eczema, all kinds of skin reactions. But then, of course, as I said, just not something is wrong, not growing. What's going on? But I would say usually we get the some kind of. But of course, this is now we're talking sort of hypersensitivity in general, and we talk about foods that fish or something you can react to, fruits. But then, if of course it's something completely different, if we talk about diseases like celiac disease or inflammatory, I mean that's something completely different. But we talk about hypersensitivity. This is the case.
Yeah. What about colic as well? It's a very stressful situation.
Indeed.
We hear about all the time, and it seems such a mysterious condition.
Yes.
Could it also be linked to allergies or to elimination diet?
Yes, I think the other way around. That colic is sort of, this is the diagnosis you get when you don't have anything else. So I think that's the main thing, that we don't mix them up, that it's part of something. But so the definition of colic is what we say, crying more than 3 nights a week, more than 3 weeks, more than 3 hours each, and etc. So it's something that goes on, and most of the children actually are more uncomfortable. Small children, breastfed, are more uncomfortable in the evenings. So that seems to be something natural, that even though they sleep well at night and then they are happy playing in daytime, and then even though they sleep in the afternoon, they tend to cry more in the evenings. So again, it's like, what is the definition? When is the crying too much? And they want to breastfeed a lot, they want to be comforted. And so when it is a colic, I would say you can say that if it's that typical, if you have an hypersensitivity, that's usually, I usually say that the body doesn't know the clock. And that works a bit because we still have some kind of cycles. But as you said, usually you see the reaction with pain in the abdomen after some kind of meal or connected to go into the toilet or usually it's not like those hours in the evening, always a pain, and then it goes out to being milk protein, allergy, and then eliminating that, and then those symptoms completely disappear. But of course, we can have combinations, and we can have both of the things. So that is the thing about medicine. We have to think broadly to try to narrow it down and what makes sense at this specific situation. But colic, I think, is very, very interesting. But also for the mother to understand what's happened, and then we have those weeks where we start to have a child that cries more and changes behavior. So sometimes it's just getting to know your child, because the first period of life, everything is taking the child to the breast, and the child cries, the child is hungry. But then we've realized that the child might want comfort, or something else might be uncomfortable, but the child can't tell you what it is. So passing stool or needing to throw up and other things. So I think it's the whole thing with learning to live together and developing and what is a child, what are the signals. So I don't say that we can normalize everything because we want to find the allergies, but it's a little bit of getting to know each other those weeks.
Yeah, it can be many different aspects. And colic is actually one of those conditions that has been associated to the gut microbiome. Yes. So there are some studies that show that babies with colic have a different gut microbiome. And in particular, they lack some bacteria that are associated to the immune system, but also to lower inflammation and to metabolism and even to the brain connection. So there are some studies that talk about that. And there's also some studies that show that probiotics could help with colic.
Yes.
How do you see that as a doctor?
Yes, I think that's very important. So we started to actually getting studies showing that. I think we've known it in the practice for quite a while. But it's, again, it's difficult because then we need to talk about the probiotics, the costs of them, and is this for everyone, and should that be a medicine if we know that it helps, something I can prescribe to the families that really can't go and buy those things, but we know that it's helping. So I think it's an important question that I personally would want to raise, that if we see that it's helping, why can't we help these children more? And most parents choose, of course, to buy these things, but it's nothing I can write a prescription on. And then we have all of the other, anti-gas products that is sometimes recommended. And what we see in the studies is that they are completely harmful. They're not dangerous, but we have basically the same percentages as placebo with improvement rates. So that is something I think we should be careful of recommending, because of course it's not dangerous, but you will spend your money on something that we don't have any evidence of. On the other side, when you're desperate, you're willing to try everything, and we see that for some babies this helps. So again, let's be humble and say we don't have the whole picture yet. Yeah. But I want to focus on the probiotics that we actually have studies on.
Yeah, and that's also one of the reasons why we started the PREVENT study in Sweden. So we have 300 families that participated in the study, and we collected gut microbiome samples from babies and children, and we collected a lot of questions about their lifestyle, their diet, and their health as well, their symptoms. So the objective of the study, and we do it in collaboration with Uppsala University and other universities, is really to establish this link even more between the gut microbiome in children and different symptoms. And some of the symptoms we focus on are colic, constipation, eczema, and also allergies. We already see some correlations. We're so excited about this because we see a link with some of the symptoms, but we need to do a bit more research there. What would you be most excited to see as a doctor?
All of it. I'm so much looking forward to the rest of the results, but everything about it. I mean, as I said, colic, it's so important because we don't know what it is, and we see these parents, they are so tired, and again, we want to. I can't be in the podcast without mentioning the shaken baby because it's a real risk, and I just want to encourage all the parents that are in this situation with listening because they're desperate and saying we need some help. First of all, remember to sleep in shifts. Remember to take help. You are not a bad parent if your child is crying. It's not your fault, but the child probably needs the comfort, and you get tired if the child keeps crying. So while figuring out what we can do to help, we need to take care of this acute situation, and that is make sure that the parents get help, and if there's actually no one there, make sure that you talk, mother and father, and sleep separately so someone actually gets some rest and be there for the child. So whatever, when I say that the first months can feel like eternity, and each second of the night just feel crazy. But then when you look back, it's such a short period of time. So make sure that you can handle this. So just saying that when you feel I cannot handle, I get crazy, the child keeps screaming, it's better to put away the child and just go out and breathe. The child can scream for a while. Remember not to ever become that crazy or desperate to shake your child. I think that's something we need to point out, because that's also lifting these things is also acknowledging that having a child that screams is horrible. It's horrible, not only for the mother with the hormones, but for everyone, hour after hour. So we need to help these families, and we need to make more studies and to understand how we can help them more. But it's obviously something with the development and more food, and that it creates this that the guts can't handle that much, and that's why it's coming in this particular age.
This is so important. I love that you're touching upon this, because we always talk about child health, but the parents' well-being is also so important, because if you're not the best version of yourself, maybe you cannot take care of your child.
Then you start being in the bad going down with more and more symptoms, because you don't give the child the warmth that the child needs. And the balance, probably most of the time we have a bigger sibling in the family, and then you want to give the perfect food and start cooking, because I think that's the next step. What kind of food should we give to the children? And being stressed, that's not a solution, and trying to do too much. But let's look at the things that we actually can do. So before terming the colitis, I think we should just say that I always recommend probiotics. And then the family asks, which one should we take? And that is also something we have to say, that we don't have that studied, because we don't know your child's particular. We don't do that in healthcare. We don't check, but I think that's probably the future, that we can individualize the child's gut health and see how does your bacteria look, and what do we need to add to help you, and that's something I think is to be seen in the near future.
Exactly. That's what we do at Alba. We really believe that we should test the gut microbiome to know what a specific child needs, also based on their food. So it's not just the probiotic, but it's also what you feed them, because they also boost certain bacteria, and that should be a holistic perspective, and a personalized perspective, because what we know today is that yes, there are some good probiotics, but is it right for my child? Do they need it, or it's not related to the gut at all? Maybe it's not. So why going into the probiotics? And if so, which probiotics is the best? So that's really what we aim to discover, and we aim to bring those solutions for parents, hopefully very soon.
Yes, that's amazing. We want to know what kind to add to make the treatment good, but then just saying that giving too much is not harmful either.
Yeah,
that only means that it will pass by the stool. So again, it's just a matter of a cost.
Probiotics don't have a lot of side effects. They can be bought over the counter, and they're generally regarded as safe for children as well. Great. So we talked a lot about the gut microbiome. Now moving a bit towards nutrition and diet. As a doctor, how important is diet in these first years of life? And how connected do you think diet is to health?
Incredibly important, I think. Again, I think we've covered the first 6 months, and the first 6 months, except from vitamin D, which of course should be supplemented, which is the recommendations. Nothing else is needed. We can say that the breast milk covers the rest, and physiologically we know that the iron is not enough, so that's why we should start giving other foods from the age of 6 months. And of course, the child can start tasting things from the age of 4 months, but it doesn't have to in a nutrition from a value perspective. It's not needed. So what we know from the age of 6 months up until 1 year, we want to increase the amount of food that the child eats. And I would say from the age of 8 months, it's good to have 2 proper meals and some snacks in between. And when I say snacks, I don't mean eating raisins or drinking juice or those different kind of children's snacks. They don't need that at all in the first months they start eating. That means that they eat with the parents and start trying things, and then proper meals. So I think we can't talk about those what they should eat without mentioning the meal situation. So I think food should be something joyful and so take out the stress, and usually it's like, how much should they eat, and I don't know what's relevant, but if the child grows, that's usually fine. If the child doesn't, I think we should personalize it and talk with a nutritionist and see what's needed. But just sitting with the whole family in a dinner situation is very important to start learning from the start that this is something, and by what do you have in front of you, what looks good, because if you look at toys, they are extremely colorful. So usually children are interested in what has a lot of colors, and the same should go with food. So I think that's sort of the answer itself. Don't go with the processed food. Don't go with the fabricates. Yeah. So just the food with the colors. That means vegetables. That means the fruits. Yeah. That means that the child can pick her himself and try things. So that's probably the first learning how to eat phase, and from the age of 1, of course, the child can start eating the food as the rest of the family. What I would say is, except from the sugar, just while we say everything,
yes,
it's so easy to be completely everything, but then we talk about food. We don't talk about desserts. We don't talk about the candies. And the children, they don't need that, because once they've gotten the taste of it, we are programmed in a way that this is something we want more of, but the child doesn't need it. Actually, none of us do. But it doesn't make sense to start with that. Personally, if someone asks, I would say maybe the age of 3, because then we are in a social situation that the child understands, and we have birthday parties and Christmas and and you want to try everything and be as adults.
Yeah.
But I don't know, can compare with alcohol, it's obvious that you can say no. It's something that you cannot have. So why can't it be the same with the sugar? You don't need to eat candy.
Yeah.
It's that just that. And the more what you have in front of you, that's what the child's gonna want. It's interesting. So I would say always have fruits at the home, actually on the table, get the interest.
Exactly. And as we were discussing earlier, there was a study recently that showed that eating sugar in the first few years of life is associated to diabetes and to weight and to obesity later in life.
Yes.
So what really is important here is that some choices that maybe you make today in your family might affect your child later in life.
Indeed.
So that's very important. And I think in Sweden, there's also a recommendation of no sugar below 2 years or even a bit later in life as well. So sugar is a very important one. The other one is fiber. So it's every government, I think, recommends to eat fiber and diverse fiber. And I think in the Western world, the average in the population is below the consumption of fiber.
Yes.
And the reason why that's important for the gut microbiome is that bacteria feed on fiber and are boosted by different types of fiber.
So this is what we call the probiotics.
Yeah,
prebiotics. Exactly. So we need to talk about this differently. So we've covered the probiotics, which is something we can intake, and that is actually the bacteria. But let's talk about the prebiotics. You have to keep the tongue correctly in the mouth. Yes,
exactly.
So and going at the sugar, of course, that's the opposite. That's part of why we don't want, because that doesn't do any good at all. So we need to have the food nutritionally dense.
Yeah.
So and that is because of all the processed food. We get so full. We feel like we've eaten enough, but we don't get the nutritionally correct things.
Exactly. So the big 3 that I'm taking away from you is like fiber, prebiotics. Try to maximize that. Try to reduce the ultra-processed food and the sugar. Those are the 3 big themes that also we see that are important for the gut microbiome and for health in general. And these are also recommendations from the government.
Yes. But with the fibers, with the small children, I think when we've got problems with diarrhea or constipation, you think, how much fiber should I add, or what should I do? And I think we should just remember that the children usually can't take as much fibers as the adults.
Yeah.
So we can't say that, I need to give because I know that I've learned myself. So, but you can do a mix and you can add stepwise.
Yeah. And also from the gut microbiome perspective, a child's microbiome is developing over time because, as we said, we're born sterile. So there's almost no bacteria. And then they start to come. So the gut microbiome is still very immature and smaller, you could say, in number. So as you say, fibers should be introduced over time and step by step.
Yes.
And so this is about diet. What do you see in your patients, like with the families you see day to day? What are the challenges regarding nutrition? What do you see?
Again, I think it differs a bit with the ages. I would say that the smaller ages, the challenges are usually with the families being stressed that my child does not want to eat. My child is not interested in this, and that's a huge problem. And sometimes at Baby Well Center we get the critique that everything is about weight, but turn it around, that's usually the main problem as well. And I would say that in that age, don't overdo it, don't stress too much. At that age, most of the bought food is already thought through. That you don't have to do everything from start. That the food is not processed, even though it's ready to buy, and also talking about porridges, you have all the extra iron, the things that you need, zinc, like those things. So we have that with the smallest children, but as soon as we go up in a little bit older ages, we start preschool. I would say it's a matter of learning the way the rest of the society works. And I see the main problem is that families feel that, well, the children can't eat the same that we do. And then there's been something around the children can't have any spices.
Yeah.
And that means that they don't want it. And then we boil the macaronis and we have the meatballs and the sausages that are processed containing too much fat, not too much protein, and far too much salt. And that's the main thing, because they are easy to chew and it just, goes down, and the child feels like, I'm happy that my child eats. So I would say that the main problem in those ages with preschool is that you forget the things that you knew when you were home on maternity or paternity leave, getting all the colors, getting the child to eat in their own pace. When you are on a daily life, you have the preschool, you are tired, we have to make the dinner, everything is a little bit more stressed, and you're sort of in the wheel of everyday life. You are happy that your child eats, and you forget the vegetables. Yeah. You forget the finding different flavors and being happy about food and sitting together as a family. And by that, it comes the sort of hurrying with just filling your stomach without considering the nutritional value of it. And then with that comes the forgetting the fibers and all of those parts that we need. And also the social pressure. I would say that the problem is that everything that is easy is sort of fast and processed. Yeah. Yeah. So it's difficult to get the puzzle in life. How should I prioritize? But my personal recommendation is doing it super simple with small things along the way. So let the whole family eat the same food. And of course, if the child refuses, I would say that one time is not a problem, but there's no use of not even eating the dinner and then just taking a sandwich. I mean, just compensating that 1 hour later, or even worse things with sugar-containing snacks. But my personal tip for each parent out there coming from preschool, starting to cook the meal, is to lay out the different kinds of vegetables before the main deal, before the dinner. And cucumber, carrot, tomatoes, whatever your child likes. But that means getting those fibers, getting those colorful vitamins, and filling up the stomach enough, not completely, because there is always a balance and you have to know your child, but that means that you at least get those things. And then in the dinner, if it's more difficult to eat with a fork or a spoon, then at least you've got something before.
That's fantastic. That's a very practical tip. That's very, very valuable. And it really seems that sometimes it's normal that you need to offer a food to your child many times. Actually, some say even 20, 30 times. Yes. So it is normal. And sometimes just for them seeing it available around them can just make it familiar. And over time, it might help them to recognize it and to find it like, that's what food looks like.
Yes,
and that's what I recognize. But I think you're spot on. Our society and our food system is changing. Even as an adult, you can see that everything is fast. We're on the move. We're on the go. We need something quick. And what's available and what's packaged and can stay in a shelf and can be preserved often is lower in fiber. So it becomes harder and harder to be healthy, and we need to think about it and we need to put some thought about it. And as you say, you don't need to be perfect. It's just about finding some few actions that are in your daily life, not thinking about the special occasion or the event, but just thinking about what we do in the day-to-day. And there is one type of food that is a bit less present in our life than it used to be decades ago, let's say, and that's fermented foods. So fermented foods have live bacteria into them. It could be yogurt or kefir or sauerkraut. There's many types of foods, but they're a bit disappearing from our diet. What's the recommendation around this food, if there's any?
Exactly. What's the recommendation? Because in general, we haven't spoken about them that much. I would say in general that it goes along with everything else, that let the child learn to like the taste, and fermented food, we know it's very good for the prebiotics.
Yeah,
and that's very helpful, and also to again to get it from the start. So I would usually say that just getting one piece, and if you realize that I don't like it, then come again in a week, or 3 or 4 days in a row if it's not like super bad, and just learn, teach the child to start appreciating it. But from a nutritional perspective, I would say that we consider the smaller child and the amount of salt, how they have been packed. And another thing I say in general, it's fine, but for instance, if you make kombucha, the tea yourself, remember to check that. I wouldn't recommend that to a child, because they might ferment to contain alcohol. And of course we don't want that to give in to children. So just consider what you have in front of you. But in general, I think it's super exciting to switch the mindset to giving these foods also to smaller children.
And to try them as tasters and to get them introduced over time.
Yes, indeed.
That's fantastic. We covered a lot of topics in gut microbiome and nutrition. Maybe my last question is about the future of medicine. Our view at Alba is that in the future we'll have medicines that can help us with acute situations, but nutrition will also be a part of the healthcare system. And we will not only take care of patients or solve conditions with medicines, but nutrition will also be a part of it. How do you see that?
Yes, let's hope that will be the case. I mean, we want the health care system to be not just when you become sick already, but actually to take the whole person. But of course, it's a lot about your personal responsibility to make sure that what's best for me. If we take it even further, I might even fear that we have more and more insurance companies getting into this equation, saying that if you have these and these conditions, it will be impossible. So I not to become too afraid of everything, but more to be open-minded and realize that this is my personal journey, and I can't expect a doctor to fix it for me. So I would say that in general, if I want to change something, we know that a behavioral change takes at least 12 weeks. So stepwise, I wouldn't like anyone to listen to our discussion or go into a nutritionist and say everything will change today. Because then we know that in a few weeks it has been too high a mountain to climb, and then you just don't care about anything. But stepwise, what can I do? And be conscious about what's important. And then if you reach to 80, I love the rule of 80-20, that if we succeed the 80% on our everyday life, we might have days that it's not perfect, and that is something we must remember as well, that your child's gut health won't be destroyed by one hot sausage at one party one Friday evening. That's not the case. I mean, we can handle a lot. Our bodies are made to handle starvation and to handle too much. If you eat too much one day, you will just sort of, the body will understand to skip a few of the calories, but the everyday life should be balanced. I think that's the take home message, that try to do the best for your family and go into that direction with the more fibers and more colorful food and reduce on the processed food, and with that we can come a long way on the journey.
This is a fantastic message. I really, really agree with this. And I've been through that myself with my eczema. There has been a time where I discovered that then avoiding certain foods or avoiding certain triggers made me feel better. Mm-hmm. And that made me so anxious and so scared and afraid about everything. Yes. I was so paranoid about everything that would that I would eat. Exactly, because I was so afraid that maybe it's also this other food or this other food, and that actually made my symptoms worse for a while, because stress also affects our symptoms, and it affects the gut microbiome. Yes. But in general, it affects your sleep, your mood, and then it's all a negative loop, as you were also saying before. So what really changed everything for me was to understand that I should eat in a balanced way 80% of the time, and then I can allow myself to go somewhere and eat something a bit different. And I learned not to be afraid of food, but just to remember some core habits in my daily life.
Indeed.
That really changed everything for me, and especially over time, I could see the compound effects, and I really found my balance. But I hear all the time people that are stressed about one particular thing, and that's also my message, that in the end, health is, we don't try to only optimize for the gut microbiome. We try to optimize for a well-functioning life and a happy life and a healthy life. And that's made of many different components. So I love your message and recommendation. That's amazing also to hear it from a doctor. But I think we've been through all of our topics. Thank you so much, Erica. This was fantastic. It was really great to hear your perspective.
Thank you. Thank you for having me here, and looking so much forward to the new studies and the results, and let's continue to see what we can do with the pre and probiotics for our gut health.